Okay, let's talk for a second about surgery day. So there's probably gonna be some anxiety around this. Let's just get it out there. Totally normal. This is beyond your control. Depending on what time of the year you're checking in, there's a lot going on. Your parents, your spouses, they may be able to come with you or not come with you. My wife had to drop me off and pick me up in the afternoon. It was like a man's spa day, right, at the hospital. But there are some things that you can begin to wrap your head around. First and foremost, that you're in control of your own health here, and that this recovery process is not a passive process. It's very much going to be driven by you and your experience. So there are some things. If you may be going through this surgery and have to stay in the hospital for a few days, that's okay. You may go through the surgery and go home the same night. That's also great. You'll probably do better at home if you can. But a couple things to anticipate. One is that your physician and surgical group will walk you through all of the things that you want to have, from your prescriptions on board, if you have for pain modulation, to stool softeners, to antibiotics, things like that. You'll have those things done. That's what I'm not worried about. But what I want to talk about is sort of a couple things. One is sort of the nutrition component piece. If you're going to be in the hospital for a few days or overnight or longer, don't be afraid to bring your own food in. Remember, we're trying to up our protein here, and sometimes without, do I think eating some toast and a glass of juice is going to wreck you? Of course not. You are a durable, amazing human. But if it gives you some agency to change and not eat pancakes and a whole bunch of things like that, that's great. The second thing is you can request, you could take your H-Wave device into your pre-surgery meeting and say, hey, this is a device to squeeze my muscles away from the surgery site, where I'm going to try to decongest and keep my quads or my hamstrings or my biceps sort of attached to my body and working. Can you put the pads on underneath? I immediately woke up in surgery, for example, and started flexing my quadriceps. My surgeon's work was done. He had gone in there and done what he needed to do, and I woke up and immediately started recognizing that I wanted to move as much as I could. When this situation, it was just flexing my quad and wiggling my foot to keep that neurological connection. And then as I was waiting around during the day, I was there for a few hours, and I went ahead and hooked up some pads and started pumping. In fact, you can see the pads in the radiograph and the x-ray that they took around that, just to make sure everything was in place. Really your chief goals, as we mentioned before, are swelling management. And one of the things that I think is a lost opportunity to address is to get ahead of swelling early on. Oftentimes patients are in the hospital, rehab, physical therapy is coming to make sure that you are good on crutches, good on a walker. But really, you're sent out without a lot of good post-surgical swelling management. And that can begin very, very early, so that you're not 6 to 8 hours behind. Imagine what would happen if you sprained your ankle and didn't do anything on it for 6 to 8 hours and blew up, and then you're like, okay, now let me start dealing with this. When you sprain an ankle, we're on it right away. And you certainly won't let your kid just dangle their foot and swell sort of unnecessarily. So keep in mind that there are some things you can be doing, that those ankle pumps that they're prescribing are about blood clots. Wearing the compression socks is great. Ask for the compression boots if they have those. Those will just squeeze your calves so that you're getting more circulation. Squeeze your butt. Do what you can to be, asking for hot packs for your groin or for your arms. Control what you can control. Get ahead of the swelling. And remember, the goal here is that this is never going to make or break your experience. But what we're trying to do here in the hospital is set ourselves up for that first night, where we're going to have sort of potentially peak pain or peak breakthrough of discomfort as the sort of anesthesia wears off. And sometimes people don't have any pain, and sometimes people get a lot of pain. The anesthesia wears off and it's a shock. Staying ahead on your pain meds, and along with what's going on with your swelling, can be very, very powerful. No one likes to take pain medication. I've never met anyone who does. So keep that in mind, that your physician is prescribing these meds initially so that you don't become flooded with pain. Once that breakthrough pain has happened, it can be really tricky to sort of modulate that back. So managing your swelling, staying ahead, and then tapering off as appropriate is great. The other thing I just want to point out that oftentimes people report that they're disappointed that the first night had really rough sleep. And that's okay. I just want to prepare you that we don't expect you to have a great night's sleep. Your brain is in threat mode. You've just had a major surgery. And more importantly, let's use that first sleepless night as an idea that your brain is protecting you, that all of that desire to move or to wake up and not go to sleep is that your brain is saying, hey, we got to keep moving. We want to decongest those tissues. We don't want to stay in one site for very long. It's actually one of the reasons we don't mind if people have a little bit of pain that they can easily manage. Don't get me wrong, I'm not saying you should be in writhing discomfort, but if people go numb, oftentimes they'll stay on a side too long, they'll challenge a new tissue too long, and that need to fidget, that same chronic persistent pain you may have had prior to the surgery, that's a protective mechanism to keep you moving. Of course you're gonna nap, and of course you're gonna need good sleep later on, and there are plenty of ways to sort of enhance those things. But I just want to put and change your perspective about this, that it's going to be okay. We've got these breathing sort of techniques and skills that we can engage with. There's plenty of time to read and watch TV, and it's okay to sort of feel like you're pulling an all-nighter that first night, to kind of doze, have fitful sleep, because it's your brain protecting you. So as you roll in there, we're thinking again, a couple things. One, what can I control today? What's in my agency? Because I don't feel like I have a lot of agency. Two, hey, I can start to control my food. I'm not going to eat that toast and those cookies. I'm going to just stick with the massive amounts of proteins and fruits and veggies, drink a ton of water, right? Make sure that I'm well hydrated on those things. I can manage my swelling early on. That's my responsibility. That's no one else's responsibility. And then setting myself up for a successful first night with the expectation that it might be okay. I'm going to stay ahead and make sure that I'm ahead on those pain meds, and I'm really aggressively managing my swelling through the night. Those things tend to lead much, much bigger, sort of better experiences. And remember, your body is a healing machine, and you've got this.